A fingertip amputation occurs when part of the finger from the joint closest to the nail, known as the distal interphalangeal joint, or DIP joint, to the tip of the finger is cut off, or the pulp or pad of the finger is removed. Traditionally, fingertip amputations have been treated surgically with skin grafting or local flap techniques. However, most fingertip amputations are amenable to conservative management. Conservatively, fingertip amputations are treated utilizing a protective semi-occlusive dressing called a tegaderm. The tegaderm allows for moisture vapor and oxygen exchange, setting up the preferred moist wound environment to allow for re-epithelialization or the formation of new skin of the wound. A moist wound environment enhances the epithelialization process by easier migration of epidermal cells, faster epithelialization, and prolonged presence of proteinases and growth factors. The tegaderm dressings are utilized for about 2 weeks, and depending on how the wound is healing, it will be changed every 1 to 2 weeks by your hand surgeon. The tegaderm is covered by Coban to help shape the tip of the finger. The Coban dressing, which your hand surgeon will demonstrate how to apply, will be changed daily by the patient. After the initial 2 weeks with the tegaderm dressing and signs that the wound has begun to re-epithelialize, the tegaderm dressing will be discontinued. At about the 2-week point, depending on the healing, we will transition to daily dressing changes utilizing bacitracin, Vaseline, or Aquaphor, placing directly on the wound covered with Coban to continue to shape the fingertip. This dressing will be utilized for 2 to 4 weeks. Throughout the entire healing process, the patient is provided with a splint to protect the end of the finger, allowing for quicker return to work or activities. After the tegaderm, which is the occlusive dressing over the fingertip, is applied, fluid will accumulate under the tegaderm. This fluid, which contains the appropriate macromolecules and growth factors to facilitate skin growth, may appear discolored or even look like pus. This is to be expected. It is recommended you inspect your finger for signs of infection that include but are not limited to redness, swelling, increased pain, or warmth in the adjacent tissue. If you notice any of these signs, please call your surgeon immediately. Initially, the amputation site will be highly sensitive and painful. As the amputation site heals, the pain will subside. The splint can be worn as needed and is not required to be worn full-time. Patients usually return to work or activities within the first week of the injury. Many patients even return to work the following day. The average time to complete healing is 4 to 6 weeks. Smaller wounds or amputations may heal faster. Your surgeon will inform you how often the tegaderm should be changed. Generally, the tegaderm will be changed 1 to 2 weeks from initial application. You will likely follow up with your surgeon weekly for wound checks. Coban will be wrapped around the tip of the finger to help form its shape. This will be changed daily by the patient. Before applying the new Coban each day, you may shower over the tegaderm as it is waterproof. Let the water flow over the tegaderm and pat dry before applying the Coban. After the initial 2 weeks, you will no longer have a tegaderm dressing on the wound. The patient may continue to shower as the wound can get wet at this time. Allow the soap and water to flow over the open wound. Please do not scrub the wound, as this will damage the granulation tissue or the newly formed skin. After the shower, gently pat the incision dry and apply the bacitracin, Vaseline, or Aquaphor directly on the wound. Cover with Coban as directed by your surgeon. The Coban will act as a bandage to keep the wound clean while also continuing to shape the finger. The splint that was provided at your initial visit should be worn as needed throughout the healing process. This approximate healing timeline shows what to expect during the 6+ weeks that your fingertip amputation will be healing. Given you resume use of your hand shortly after the injury, grip strength is usually maintained or quickly regained. The extent of nail involvement will determine if there will be a permanent deformity to the nail. The picture above shows damage to the fingertip initially sustained at the time of injury. As the finger continues to heal, The nail will grow in, but likely have some minor deformities to the nail. Most patients will experience cold intolerance at the amputation site that is most notable around 2 months from the injury. With time, the cold intolerance generally diminishes. Most patients report cold intolerance resolving about 1 year after the initial injury. Following a fingertip amputation, patients will typically have some level of decreased sensation at the tip of the finger. This varies depending on the severity of the amputation. Most patients only report mild decreased sensation in the fingertip that sustained the amputation compared to non-injured fingers. Conservative treatment has proven to provide to be equally effective, if not provide better results. Most fingertip amputations do not require surgical intervention and can be treated conservatively. However, some fingertip amputations are not amenable to conservative treatment and will require surgery. Your hand surgeon will discuss with you these options, and based on the severity of the fingertip amputation, will discuss with you if the fingertip amputation can be treated conservatively or if it will require surgery. First, we're going to fold over the tegaderm like this and pinch the edges together. Then you will peel off the surrounding white part. After that, you will fold the edges over. Then take a secondary tegaderm and then wrap in the opposite direction. The goal is to try and make a better seal up top. Once you are all said and done, the goal is to try to trap as much fluid in the tegaderm as possible, and then we will overwrap that with Coban to start to shape the finger. Fingertip amputations are difficult to see at first. Most fingertip amputations over the course of about 4 to 6 weeks heal with only mild deformity and are highly functional. Here is an example of a patient's fingertip amputation results utilizing the tegaderm dressing protocol. The day of injury, 1 week, 2 weeks, and 4 weeks post-injury photos demonstrate how the fingertip has healed. As you can see in the pictures, the range of motion of the DIP joint has returned to normal, allowing for full extension of the digit. The pulp or pad of the digit has re-epithelialized with a rounded appearance due to the Coban shaping the tape of the finger. Only minor deformity can be observed at about 4 weeks from injury. Thank you for watching this video provided by Orthopedic Associates of Wisconsin. To schedule an appointment or to find out more information, please call 262-303-5055 or find us on the web at orthowisconsin.com.